Hello, I'm Dr. John Cruz, and today I'm going to be talking about ADHD and pregnancy. I'll be talking for about 20 minutes, and if you have questions while I'm talking, you can type them into this Facebook Live presentation. This will also be posted afterwards on YouTube and Facebook, so if you have questions later on, you can post them there and I will try to answer them. So this is a large and diffuse topic with unfortunately not enough data on ADHD and pregnancy. I'm going to try to address 4 different angles or approaches. One is, what is the impact of pregnancy on ADHD symptoms? And my takeaway short answer is unclear because we have virtually no studies. The second question is, what's the safety of stimulant medications during pregnancy? And there the takeaway is we have a modest amount of information, not highlighting any major, greatly increased risks. Any increased risks are probably pretty small. Then what's the safety of stimulant medication during lactation, breastfeeding? And the answer there is we have even less information, and there's more anecdotal, small case studies suggesting Ritalin is pretty safe and almost nothing on stimulant, on the other major stimulant, Adderall, amphetamine-based products. And then hopefully I'll have time to touch on a little bit that although there's a strong genetic component to ADHD, we also know that there are environmental factors that can increase the risk of developing this disorder. And many of those are events that happen during pregnancy or there are strong correlations with cigarette smoking, prematurity, a few other things during pregnancy that at least are associated with higher risks of developing ADHD, whether they're causal or not, I'll hopefully have time to address. So a little of the background. So estrogen, what we consider the female's hormones connected with the female's gender, has lots of effects, not just on sexual developing bodies in sexual ways and not just with the menstrual cycle, but has effects on the brain. And the effects on the brain include general increased blood flow within the brain, diffuse anti-inflammatory actions in the brain, and there are specific estrogen receptors within brain tissue, so that estrogen very clearly acts as a neuromodulator. It acts, the overarching simplified summary is that it has neuroprotective effects in the brain, and it also has neurotrophic effects, which means it encourages the growth of certain, if not necessarily nerve cells, but in mammal brains, but at least nerve projections, synapses, dendrites, manifestations of the nerve cells themselves. So the other sort of basic information is that estrogen increases during early stages of pregnancy and then stays at very high levels throughout pregnancy and then drops fairly dramatically at the time of birth. So there are very different estrogen milieus that the pregnant person's brain is exposed to. And the effects of pregnancy on mental health have been studied extensively, but the big focus has been on anxiety, depression, and much less on ADD itself. So we know rates of anxiety increase substantially during pregnancy. We know, again, this is in the general population, not just in individuals with ADHD. We know that rates of depression increase markedly during pregnancy and stay high during the postpartum period, with the postpartum period right after birth being the time most likely in a woman's life that she will ever develop pregnancy. Not that most women do, even most women with histories of depression, but still that's the time of greatest vulnerability. And there's a few studies looking at cognitive factors that particularly spatial memory seems to decrease during pregnancy in response to these higher estrogen levels. So I've looked through PubMed and other sources. I've read reports. So this was a summary of ADHD in females across the lifespan and the role of estrogen. And it discusses some of what I've just said in terms of estrogen's general effects. And then it proceeds to talk extensively about hormonal fluctuations during the menstrual cycle, differences pre-pubertally, pubertally, and in the postmenopausally, and how those all might affect ADHD. And yet in the body of the work, there's almost no mention of what effect is there on ADHD symptoms during pregnancy. And part of the answer to that is I could not find any published studies directly measuring what's the effect of ADHD on ADHD symptoms of pregnancy. There is one pre-publication study, and it's a tiny study, 25 women studied at Harvard, and they used different ADHD scales, one an observer scale and one a self-reported scale, and looking at both inattentive ADD symptoms and hyperactive symptoms, and they did not detect any change in ADHD symptoms during the course of pregnancy. They did find, sort of in common with the larger studies, changes in mood, so depression and anxiety did increase during pregnancy. On the other hand, separate from that one study, there's a wealth of anecdotal information, and particularly in clinics that specialize in treating women with ADHD. And the claim from these clinics is that it's not uncommon for there to be a decrease in ADHD symptoms during pregnancy. And again, this is attributed to the increase in estrogen, and estrogen, again, may be helping preserve not just brain cells, but projections, dendrites, and other aspects of how brain cells communicate with each other. And that, again, the anecdotal evidence from these women-centered ADHD clinics is that in the postpartum period after delivery, there's often an increase in ADHD symptoms that lasts for weeks or months. Now, my own clinical practice, I have had worked with many women during pregnancy, women with ADHD during pregnancy. I cannot recall, and I've tried to specifically retroactively go back and ask some of them. Not a single woman I've worked with has reported during the time or retrospectively feeling that her ADHD symptoms were resolved or not resolved or even improved during their pregnancy. So my anecdotal data doesn't line up with what some of these clinics say. I'm not saying it's not so, and they certainly have bigger sample sizes than I do. And I do have a wealth of anecdotal claims of women with ADHD having increase in ADHD symptoms after delivery. What gets complicated then is that their demands are different. Many of these are working women who are becoming mothers for the first time, or maybe even not the first time, but it's a very different set of demands, and particularly it's less scripted, less constrained, more wide open, what you need to do to take care of a young infant. And again, factors related to anxiety and depression can also interact with ADHD to magnify or, in some cases, shrink ADHD symptomatology. So again, the summary there is it's amazing how little this has been studied, given that we know, again, somewhere in the 3 to 5% of the adult population has ADHD, and that may be somewhat lower among women, but it's not dramatically lower among women than men. And many of these are people who are getting pregnant. We should know more about how ADHD changes or doesn't change during pregnancy. So the biggest concern women that I'm working with who have ADHD and are on medications, questions they come in with is, should I continue my medications during pregnancy? And there is the scientific information we have to consider, and then there's a host of personal beliefs and values and traits and fears and concerns and worries that each individual brings in. The unfortunate thing from this purely scientific state of things is that the ideal experiment would be, and this is again this is an unethical experiment. It's what would be desirable from having the information would be to take 1,000 women and expose them, equally to different stimulants and see what effects there were on developing infants compared to infants without that exposure, with mothers who have ADHD as well. I mean, clearly we're not going to do that, but naturalistically we are doing that. There are, again, many women of childbearing years are on stimulants. Some of them get pregnant without being aware that they're immediately pregnant, so particularly in the first few trimester, there's exposure fairly often. And to put these numbers in perspective, the data in the US from 20 years ago, from the year 2000, suggested that less than 0.1% of pregnancies involved exposure to any ADHD medication. And yet the most recent hard data I could find comparing it was 2013 data. So over a little more than a decade and a third, that rate had risen to about 1.2% of women during their pregnancies are taking stimulant medications. And almost 1% of that was actually Adderall amphetamine exposure, not Ritalin exposure. So that's not given the numbers of pregnancies in this country, it's small percentage-wise, but it's not negligible in terms of numbers of infants exposed. So the numbers we have to date. So the other piece of information I'll give you is that the overall rate of having abnormalities, of having malformations, of what we used to say birth defects, are on the rate of 3 to 5%. Most people, including most women about to get pregnant, aren't necessarily aware of that. We all have the image of the perfect, happy, smiling baby being born, and that's truly a joyous and wonderful event when it happens, but it happens 97, 95% of the time, but 3 to 5% of the time we do have anomalies, malformations, birth defects. So the reassuring thing is that the studies we do have with either Ritalin or with amphetamine suggest that the overall rate of malformations is fairly similar in women taking these during pregnancy to the overall rate in the background. There may be slight increases, and among more serious, and often it's the cardiac malformations that need surgery or intervention, to say the baby's 5, that's clearly a small fraction of the 3 to 5%. But there is a weak amount of evidence that Ritalin may slightly, and it's not, again, causing huge numbers of birth defects, it's not even doubling the background rate, but a few studies have found a measurable increase in that background, above the background rate from Ritalin during pregnancy, that have not found that with Adderall or amphetamine-based stimulants. So the decision for each woman is going to be an individual one, and one thing that we have to weigh countervailing that is that, again, ADHD is not a trivial problem. It's not just, oh, there's a squirrel. This affects accident rates, it affects suicide rates, it affects mood, it affects feelings of competence, it affects sense of well-being, it affects a whole host of functioning in the workplace, because many women, particularly in America, are working close to and are up to the time of delivery. And again, most of the women I have dealt with have not experienced a benefit from pregnancy itself on reducing their ADHD symptoms. So my approach for many of the women I've worked with is many of them who are planning to get pregnant have experimented for themselves. Can I function well enough in the work world or in whatever else I'm trying to accomplish in my life off of these medications before I get pregnant? And if they can't, then they have more reassurance that they did what they could to function and have a life, but that the medication was essential to them or necessary to have a healthy, happy life during their pregnancy. And again, they could continue. So I have had several women in my practice who continued stimulant medications during their pregnancy. None of them have had any problems or abnormalities, certainly in the short term. I've also had women who were successfully able to get off their medications. Most of them did feel that they were not functioning up to their baseline level of performance, but that it was good enough and that for them the balance was best to be off the medication. So again, this is, as many factors involving pregnancy should be, an individual choice and using medical information and wisdom, but also, again, not just viewing it this as medications are bad and evil and destructive and harmful, but that people are taking them for benefits, and not just trivial benefits, but to function and, at the most extreme, to stay alive. Because clearly stimulants help people stay alive when they are used as instructed for ADHD. So jumping over to breastfeeding, again, we have even less data on breastfeeding than we do on stimulants during pregnancy. The little bit of data tends to be anecdotal or small case numbers of studies, and the consensus among lactation experts is that Ritalin seems to be pretty safe, with minimal, much lower amounts in the milk than in the mother's blood, and no studies have turned up harmful effects on the children who are breastfeeding with it. And the data for amphetamine is smaller, and again, the levels in the breast milk are certainly lower than they are in the mother's blood, but there may be some greater presence of amphetamines transported across blood, so maybe more precaution to be taken there. But again, that's more based on absence of knowledge than knowledge of harm that's being caused. The other thing I should point out is that all of the studies just looking at malformations at birth or irritability after birth or immediate effects, I am not aware of any studies looking at whether there are any long-term effects. And those could be either good or bad. There could be potentially developmental problems later on in life that we're not detecting from a short-term study of kids who were exposed in utero. And it's possible that there could be beneficial effects, that maybe it changes things so that there are lowered incidences of neurodevelopmental problems later in life. We just don't know. So the last topic I'm going to talk really briefly, because we have large bodies of data showing that there are strong connections between prematurity and kids developing ADHD. We have studies showing a strong connection between cigarette exposure during pregnancy and kids developing ADHD. We have strong amount of data looking at pesticide and some other toxin exposure during pregnancy, and even acetaminophen, which is Tylenol exposure during pregnancy, increasing risk of ADHD or associated with the risk of ADHD. Part of what's difficult in these studies to sort out is that, looking at why was the baby born prematurely? Was Mother Nature sort of responding to some anomaly, problems, or in the whole pregnancy process, and it was that anomaly that caused both prematurity to happen and ADHD to develop, or was it that prematurity itself contributed to developing ADHD later? And similarly with the cigarette smoke, that one's complicated by whole levels of factors that the parents who are cigarette smoking themselves are more likely to have ADHD than the general population. That cigarette smoking is, at least at this time and place in history, associated with the wealth of lower socioeconomic advantages, and a greater number of other health concerns and issues. And there's great contention among people in the field as to whether the studies have properly sorted out all these possible confounding factors, and again, there is substantial disagreement as to whether, for example, cigarette smoking has a causal role in making some children develop ADHD or whether this is merely a correlation based on a host of other factors. So I'm going to end it right there. The next week's topic is on Provigil or modafinil in ADHD, which is still in off-label use, but a fairly widespread second-tier use. Have a wonderful October, and I'm not seeing any questions coming in right now, but if you post questions later, I will try to answer them later. That's all. Stay well, stay safe. Bye for now.